Good afternoon. It's an honor and a privilege to welcome Faculty of the Month, Professor Mukesh Khare Sahab, Emeritus Professor, Department of Civil Engineering, IIT Delhi. Sir, we all at the Bihar State Pollution Control Board, and even I would like to acknowledge that some of the industries that also would be joining this talk. So it's an immense pleasure and opportunity on the behalf of Chairman Bihar State Pollution Control Board to welcome you, sir. And I request you to kindly enlighten us on the topic indoor environmental quality, a public health challenge. Sir, with the permission of Chairman, sir, we are starting the talk today. Thank you.
Thank you, sir. Thank you so much for your nice introduction of the topic. Now, I would like to brief you that today's presentation will be presented by me, and some factors and some details will be presented by my colleague, Dr. Priyanka Kulshrestha, who was earlier my research scholar. Now she is working for the Society for Indoor Environment, and also she is an assistant professor in the Delhi University. So let me start with the title slide, where it is very clear, which I am going to discuss today, is the indoor environmental quality, which is now becoming a public health challenge, not only in India, but also many countries abroad. So I would like to discuss here what is the roadmap to indoor air quality guidelines in India. Next, please. Now, let me first explain what is the indoor environmental quality. What is the concept behind that? Now, if you see this figure over here, the indoor environmental quality consists of 4 major subdivisions. One is called indoor air quality. The other is called the thermal environment. Then it is acoustics and lighting. All these 3 important parameters involved with the indoor environmental quality. As far as indoor air quality is concerned, it affects our health with respect to the presence of various types of pollutant indoors. As far as thermal environment is concerned, it affects our comfort. If there is a high temperature inside, we won't feel comfortable. If it's too cold, then also we don't feel comfortable. Acoustics generally help the productivity, because the more the noise, the lesser the productivity of the person who is exposed to the high noise. And the last is the lighting, which affects our well-being. If there is a lot of lighting inside, and the lighting lux is also very high, our whole psychology will be affected, so we won't feel comfortable inside. Next, please. Now let's start with the indoor air quality first, which is one of the major parameters in indoor environmental quality. As the 2 lines in the italics refers over here, it is the nature of the conditioned air indoors, which circulates throughout the space and area, whether it's an office or residence or school, whatever work we are doing in the area where we work and live. And the same air we breathe most of the time. And it has been shown that about 80% of time we live indoors, whether we are in house or we are in office, or we are traveling or commuting from the car or buses or metro. Now, United States Environmental Protection Agency placed indoor air pollution as one of the top 5 environmental dangers. So you can understand that how challenging is this area. And sometimes the indoor air becomes more toxic than the outdoor air pollution. That we will explain later, why it is so. And it contributes to millions of deaths and health issues globally. And it is also associated with increased respiratory infections, asthma, and cardiovascular diseases, because many types of pollutants are there indoors, including particulates and gases. And exposure to indoor air pollutants like carbon monoxide can result in elevated carbohydroxyhemoglobin levels, which poses great health risks comparable to smoking. And prolonged exposure to indoor air pollutants may also result or contribute to the sick building syndrome, leading to a decreased productivity. Next, please. Now, sources of indoor air pollution in a typical school building, I will first discuss, because school is a very sensitive place where the children generally are taught. So in a school building, there are four major types of sources. One is the pollutants coming from outside sources, say, for example, ambient sources like traffic, and also the underground sources, that is from the soil, say radon. It comes from the soil, and other pollutants from the foundation. Then next major the source is the building equipment. If the school is air conditioned, now in many cities, many private schools are air conditioned. So the building that is comes under the building equipment, say HVAC equipment, or any other equipments like photocopy machine, etc., which generally produce the indoor air pollutants. Then furnishings, because school have got many types of furnishing. Some schools are using carpets, some schools are using board materials, which comes under furnishing, that also produce a lot of pollutants. And other indoor sources, if there are kitchen or there are pantries in the school, it also produces different types of pollutants. Next, please. This is the picture which tells the sources of indoor air pollution in a typical household. And if you see here, we have listed formaldehyde, benzopyrene, tobacco smoke if person is smoking, asbestos, nitrogen oxides, and so on and so forth. And there are many sources like dry clean clothes, stoves, and kitchen, for example, the gas, if you're using LPG or any other material for cooking. So these are various sources inside which we have shown over here with the corresponding pollutants. Next, please. This is typical picture which tells you the sources in a typical office building in which people work. One is the outdoor source, as you see over here. Say carbon monoxide from the vehicle exhaust, as shown in the left side, this one. And carpets, some office, these days they use carpets, also source for VOCs, that is volatile organic carbon. Then plants can also becomes a source because you use pesticides or any other material so that it may not get dried. And then bioaerosols also, painted wall also a source of VOCs, and so on and so forth, and photocopy machines, that also a source of VOCs and ozone and particulates. Next, please. Now, significance of indoor air quality vis-a-vis human health, if you see, it may affect different parts of the body, right from the eyes to general effects like headaches, etc. And the most common effect of these indoor air pollutants is in the lungs, because especially in Indian conditions, because we have a lot of particulate pollutants coming out of vehicular exhaust in different sizes like PM 2.5, PM 10, PM 1, etc. So they generally find its way to the chest and then to the lungs, and then very small particles can cross the air bags or air sacs, causing wheezing, dry cough, bronchitis, etc. Next, please. As far as the timeline of IAQ is concerned regarding the guidelines across the world, this is a timeline which I have tried to show you over here how the different countries have done in this area, which is a quite challenging and quite upcoming. Right from 1987, Canada was the first country who produced the guidelines for residential indoor air quality in 87. Then 1996, Germany and Singapore, they produced their guidelines for office buildings and public places. Then in 2002, China came with the guidelines based on the standards for public places, especially metro station, etc., and malls. While in 2003, Hong Kong, produced the guidelines for offices and public spaces, and also Finland, which gives the guidelines for ventilation in the new buildings. Then 2009, American Society for Heating, Refrigeration, and Air Conditioning Engineering, that's called ASHRAE. It gave the guidelines on design and construction, commissioning regarding the ventilation aspects of, within that particular building. Then 2010, Japan came with the guideline based on WHO, guidelines. And 2011, the Occupational Safety Association of the US produced the guidelines for commercial and institutional building, while 2014, the US EPA produced the guidelines for school building upgrades. And last, the 2016, Singapore again, produced the guidelines for, workplaces. Earlier in 1996, it's for the office premises particularly, but here they included all other the workplaces. So that was the timeline. Unfortunately, in our country, India, we are trying our best with the CPCB to produce the guidelines. And I can't say that we have not done anything. We have done a lot of things. And right from when Professor Saha was posted here in Central Pollution Control Board, we started this exercise with his support, and we submitted the protocol for monitoring. And now I think the Society for Indoor Environment has given a detailed report on the guidelines for indoor air quality. Next, please. Now, policies addressing IAQ, that is the WHO and ISO. What are the policies which addresses the indoor air quality? We start with WHO and ISO, the World Health Organization and International Standard Organization. The WHO issues the IAQ guidelines, which is acceptable levels for indoor pollutants globally. So based on which the countries make standards. And the guidelines cover generally the benzene, carbon monoxide, formaldehyde, radon, and VOCs. And the WHO has given CO, that the carbon monoxide has 8-hour average limit of 10 milligrams per meter cube, so that the harm can be minimized. ISO gives the framework for assessing and improving the IAQ in buildings through ISO standards, which is mentioned over here. There are 2 ISO standards, which is mentioned over here. The ISO 16814/2008 describes the ventilation and indoor air pollution sources and other IAQ factors. Next, please. As far as USA is concerned, the Environmental Protection Agency, that is the US EPA, issued the IAQ guidelines and tools for schools in a very comprehensive manner. And the US state regulations also have come out with separate regulations, like Texas Department of State Services have different IAQ regulations. Similarly, California Department of Health have a very strict IAQ regulations over there. And ASHRAE has mainly responsible for ventilation. That is 62.1 and 62.2 standards gives the ventilation aspects of the indoor air quality. While NIOSH, that is the National Institute for Occupational Safety and Health, is sets permissible exposure limits and short-term exposure limits for people working in different workspaces. And Occupational Safety and Health Administration, OSHA, is sets stringent IAQ requirements at workplaces and different types of industries and other workplaces. And it also mentions the regarding the sick building syndrome, the European Union and UK, the policies for European Union, they follow the WHO guidelines, and based on the WHO guidelines, the IAQ standards from the European Committee for the Standardization has been produced, and regulations such as energy performance of buildings, and directives have also been come out in EU, and the construction products regulation they also produce, the CPR, they call it as a CPR, that how the construction products should be regulated. Say, for example, if office is using the boards, how it should be, what should be the guidelines for the VOCs emissions from the boards, from the partition walls, and so on and so forth. As far as the United Kingdom is concerned, the IAQ guidelines issued by Department of Environment, Food and Rural Affairs, which is called DEFRA, is one of the government organization of the United Kingdom, which provides the IAQ guidelines for different pollutants. And also it recommends the setting limits for VOCs, benzene, and trichloroethylene. Next, please. Now, as far as China and Hong Kong is concerned, China is mainly restricted to the IAQ regulations under this GB or over T. There's a number of the regulations promoting healthier indoor environments. And it also recommends for reducing indoor PM 2.5 concentration, and what should be done in order to control, in order to manage the PM 2.5 concentration indoors, and especially for the HVAC buildings, where ventilation rates are also to be regulated in order to manage the PM 2.5 concentration indoors, as well as concentrations coming from outside. The Hong Kong has strict regulations for ventilation rates because it's a small country, having a lot of traffic emissions over there outside, which may find its way into the indoors. So they have a very strict regulations for ventilation rates and permissible limits for indoor air pollutant. It also came out with that. And there is a certification program which Hong Kong has started for mechanical ventilations and air conditioning system. So nobody can install these mechanical ventilation or HVAC system without getting certified from the appropriate authority. Next, please. As far as Japan and Singapore is concerned, the Japan is has got indoor air quality guideline, which is produced in 1997 in Ministry of Health and Labor and Welfare. There is a monitoring protocol for indoor air concentration of various types of chemicals in a newly built houses. Monitoring protocol for formaldehyde was also produced by the Japan. And in buildings and schools, that is the households, buildings and schools. Indoor source emission control framework has also been given by the Ministry of Health, Labor and Welfare, as well as the guidelines for the installation of indoor ventilation system has also been produced by the Japan. Singapore, as Hong Kong, is also a very small country, and it has a lot of traffic and limited space. So there is indoor air quality regulations are very strict over there. They have guidelines also, standards also, and which is looked after by the National Environmental Agency over there and Building and Construction Authority. These are two appropriate authority which looks after the indoor air quality over there and the guidelines as well. And here also the ventilation and is also very strictly maintained over there, and low emitting building materials guidelines has also been produced so that the indoor air may not be harmful for the occupants who are inside the building. So you see that Singapore and Hong Kong, both very small countries, have come up with a very advanced version of the indoor air quality. Next, please. As far as India is concerned, as I told you already, that we started in a long time back with the monitoring protocol, but now the National Clean Air Program, it has included the indoor air quality as one of the parameters, so one of the areas to look at. So NCAP has included the IAQ, and presently the building bylaws under the Ministry of Housing, it deals with the airflow in the buildings, the standards of what should be the guidelines for the uninhibited airflow, so that whatever the air coming from outside, the proper ventilation can be maintained in the naturally ventilated buildings. And as far as IAQ guidelines, standards and ventilation rates are concerned, it is yet to be formulated, for which we are trying with the Central Pollution Control Board. Next, please. Now, we are very quickly going to, prize the participant that how the IAQ research in India was incepted since 1996. Next, please. Now, the first of its kind of work which was done in urban buildings in India was at IIT Delhi, and it was done in 1990, back in 1996, where we took the IIT Delhi library as one of our, space to investigate the indoor air quality in the basement and the fourth floor. We have the fourth floor air conditioned library. So that was the work which we took out, which we took after we got complaint from the students who sit into the basement and on the fourth floor that they are not able to concentrate a lot in those areas, and they have to come out after 1 or 2 hours to get themselves refreshed. So we started this work with the help of CPCB. At that time, we were not having a good laboratory over here in the IIT. So we took help of the CPCB, and we used the minimum, instruments in order to sample the carbon dioxide concentration, because CO2 was the parameter which can give whether the ventilation inside those basement and the fourth floor, which was completely air conditioned, airtight building, was proper or not. So we took CO2 as one of the surrogate parameters to investigate the indoor air quality. And this was published in Indoor Air 96 conference during that period. Next, please. Evaluating indoor air quality using CO2 as surrogate index was also published in one of the Australian journal, where we, in detail, it has been mentioned over here that, what are the parameters which we monitored and how the instrumentation, as you see here, very, basic instruments we used, because at that time we were not having any indoor air, laboratory in this, in IIT Delhi. But thanks to CPCB, who helped a lot in order to get the work done. Then in 1999, we did a Master of Science research in indoor air quality in centrally air conditioned airport authority building. We developed some lab and we started working on the airport authority office complex. And it was found, the result, it was found that building was sick. The insufficient supply of the fresh air was found in building, and we found that 100% recycled air was being used in the airport authority building. So it was an MS research which was published in the Building and Environment, one of the topmost journal of the indoor air, by us. Next, please. Now, the environmental evaluation of public building was again done by as a sponsor research project by Ministry of Human Resources, and we did the IGI airport, the old one, which is Terminal 1 in Delhi now. It was departure terminal at that time in 2000. So we monitored those on the request of the airport authority, and here you see that we increased the parameters because our lab was being gradually developed in IIT Delhi, again in collaboration with the Central Pollution Control Board, and we found that the airport departure terminal was completely sick, and CO2 concentration was found more than 2,000 in some places, especially in the corners where the seats were over there. It was quite a sick building at the time, and the recommendations we sent that, and the ventilation, etc., was not very insufficient. And the recommendation which we sent to airport authority that you have to improve your ventilation, otherwise people will face uncomfort situation over there. Next, please. Then again, one project funded by DST was done as a postdoctoral research project, where centrally air conditioned multi-story commercial building we did. That is a DLF mall, which is there in Munirka, just near IIT, which was completely airtight air-conditioned building. And we included RSPM as well, because we bought the PM10 and PM2.5 monitors here, along with other parameters. Even ozone was also done with the ozone monitor, and bioaerosols also we purchased bioaerosol monitors, samplers, which we also did. And we found that insufficient ventilation, 100% recycled air, and high concentration of CO2, and all these parameters were, exceeding, even the SO2 and NO2 was exceeding the outside limit, because we don't have internal indoor air limit. So we were comparing either by WHO guideline or by the outside ambient air concentration, it was exceeding inside. So that was another, that which recommendation again we sent to the DLF in order to improve the, indoor air quality. Next, please. This is another one of the projects which was done by Dr. Priyanka Kulsheshta, who is going to be, our colleague now. And we, investigated the urban slums in Nizamuddin area of IIT Delhi, with different types of houses, also, in which we included the low income, medium income, and the high income group houses. And inadequate ventilation was found in the urban poor households. The main source of there was the kitchen, their chulas, because they were using all sorts of, coal and wood, etc. And outside source also. That is, these slums are generally near the roadside. A lot of outside ambient pollutants were coming inside. So, and winter, we found a very critical month for the urban slums, where the indoor air quality becomes really severe. Next, please. This was again done by the Dr. Priyanka again, where we found the gases, pollutants, as aspirable particulate matter, residential home, which was published in one of the, journals in atmospheric pollution research, and where I by O ratios of PM 2.5, PM1, and PM10 was also found out. So it was a very comprehensive, data which we took. With all sorts of modern instrumentation, which we procured since we started in 1996. Next, please. This was done in a naturally ventilated school building. One of the PhD projects, which one of our students, Dr. Randa Goel, did this project. And the results of the study indicate that the RSPM concentration in classroom exceeds the permissible limits during all monitoring hours of weekdays and weekends. And the children were exposed in all the seasons that may cause potential health hazards to occupants. And when exposed. When I say permissible limits, not indoors, but either it was WHO or ambient outside limit of those pollutants. So, and I by O ratio was found to be greater than 1, which implies that the building envelope does not provide protection from outdoor pollutants. A lot of outdoor pollutants were coming from the windows and doors, etc., all the cracks. So this was done in one of the private school, which is a very elite school near IIT Delhi, which is Lakshman Public School, which was done ultimately the recommendations were sent to the school principal, and fortunately the principal took action. And now if you come to Lakshman Public School, they have 3 layers of the trees which they have put as a barrier, natural barrier, so that students, especially on the higher floors, do not expose to the particulates. They should have done some sort of auditing after this, but unfortunately, we proposed them to do as a master's project later, but we did not get a positive response from the school. Next, please. Now, this is another same, research which we published in the Lakshman Public School in the classrooms of Indian buildings. So that is another, continuing to that research we did. Next, please. Now, the prominent publications, I just want to show you over here. It is available in the market, Amazon.com. These 2 publications. One is from Dr. Kulsheshta, and this is from Dr. Radha Goel in the schools. Next, please. And this was done by the Indo-French Indoor Air Quality Seminar we did in France on standards of indoor air quality protocol. That one of the disseminations which we did, aided by the Indo-French project. Next, please. And this is the latest PhD project which we did about in a laboratory, where we found the effect of SOx and NOx on the lime mortar and cement mortar, which is used in the building construction, that how it behaves when they are exposed to SOx and NOx. And SOx and NOx are the main pollutant in ambient air. So in government chamber we made, these were all funded by the institute. And we expose these bricks and mortar, and then we expose to the SOx and NOx from this chamber. And we have this facility here in IIT Delhi. Next, please. And then another, emission characteristics of eco-friendly sustainable building construction material. There were 2 parts which we did as an EU project with the German laboratory. And we found that what is the effect of emissions on the eco-friendly sustainable building construction material. For example, the office wall panels, etc. And we mainly investigated the VOCs. Next, please. This is a part 2 of the same project where we simulated the adsorption and desorption characteristics of those MDF, that is the board which they use in EU, in European countries, as a wall panels. So this was done with the University of Bath as one of the, in UK, as one of our partners. Next, please. This is a project which was again done in 2010 as a PhD project, where we evaluated the indoor air quality in underground metro station. 2 platforms we took, one is Chandni Chowk, other is the Patel Chowk. And this is Mr. Dr. Praveen, who did this project as a PhD project. And we found that the assessment of indoor air quality in those metro station platform was very, not very good. That both 2.5 and 10 exceeded the ambient air level of the 2.5 and 10 inside the platform. And it is completely a conditioned platform. And we found that ventilation also was very poor. The CO2 concentration was also exceeding the 1000 ppm in those platforms. Next, please. This is again numerical simulation of airflow at platform of an underground station. That is one of the Chandni Chowk station. We did the numerical simulations over here. That how the wind, when it comes, when the metro enters, the train enters, how the wind behaves, how the wind comes from the tunnel, and how it disperses into the platform, because it brings the pollutant from outside into the tunnel and then disperses this, various types of particles into the platform where the occupants are exposed to the high concentrations. Next, please. Now, I think I would invite Dr. Priyanka to, to continue the presentations about 10, 15, 20 minutes more with certain publications. Yeah, Dr. Priyanka, please. I'm sharing the, to you.
Yeah. Thank you, sir. Thanks a lot, sir. A very good evening to all of you. I think 30 minutes more to the good evening, but good afternoon. I'll take up from where Professor Khare has left, and it is important that the timeline that Professor Khare has shared, that is from where we started for the indoor air quality studies. The 2 publications that you see on screen are, a cumulative effort in organizing Asian Conference on Indoor Environmental Quality, first and second edition, which were organized in 2019 and 23. And these were the proceedings of the work which was done majorly by the researchers in indoor air research area during these times. And we have seen a good amount of research coming up. Next, please. Next slide, please. Now, taking you back to where we were, the first document of interest was made under the leadership of Dr. Saha, and we are so pleased to have him with us here. And this is the first of its kind monitoring protocol, which we had started working for quite some time, and it was recognized and was on CPCB's website in the draft format with our team, and we have some team members here also. We have Professor Taneja with us. We have Dr. Saha, Professor Khare with us. And this protocol talked about what should be the monitoring guidelines if one wants to monitor indoor air quality in any type of microenvironment that we are talking about. Next, please. So this was a basic, this was a whole document, good page document, which we have concised into this flow chart to let you know that if someone wants to investigate indoor air quality, what is the right process or monitoring protocol that needs to be followed. So this protocol was divided into 8 phases. So the idea behind it was, when we need to assess, do the initial assessment, what is it that we look for? If we see that there are occupational concerns by the occupants, let's say in the schools from the kids or the faculty, in the offices, the occupants of the office staff, or in the healthcare facilities, the people who are working in that area, probably the doctors, the faculty, or the staff members, they have expressed any area, any concern in terms of occupational concern. So now here I'd like to brief you about, there are some concerns which are linked to sick building syndrome symptoms, which are certain symptoms which come into being when you are in a building for a certain period of time, and once you leave the building, the symptoms disappear. So beyond that, once we could guess that yes, there were certain occupational concerns which were identified, the next step would be the indoor air quality and thermal comfort monitoring. Now, why the reason why we have placed the indoor air quality and thermal comfort monitoring together is we could see some correlation between certain parameters of thermal comfort and indoor air quality monitoring pollutants which we monitored. Once we have monitored these pollutants, the next step that we had was monitoring other aspects like the ventilation measurements. So what is the air exchange rate in that particular building or in that particular room that we are monitoring? Is it sufficient? Is it insufficient? That would help us to realize what are the levels of CO2 in a particular building, which we used as a surrogate index for measuring ventilation in any indoor microenvironment. After these assessments, and this is what the monitoring protocol was about, we could develop and assess a plan for post-assessment of the IAQ. So we know how the monitoring needs to be done, what could be the possible pollutants which need to be monitored in a certain microenvironment. Next, please. This is what I had talked about. So we can move on to the next slide. Now, this is an integrated IAQ protocol which has been derived and which included the monitoring protocol itself. Now, how is this protocol different from the monitoring one? This has all the aspects of monitoring, pre and post monitoring. So when we are talking about indoor air quality protocol for a certain building, let's say we have offices for the building type, we need to audit. So the office is, what is the structure, how big are the rooms, what could be the potential sources of pollutants. If it has a lot of furniture around, so could TBOC be a problem? Like in schools, I would like to mention in all the research that we had done, the very important aspect that we found out could be the possible source was the dust chalk. When the students, when the teachers are writing on the chalkboard and there's a huge line of the dust chalk which is there below the board, the moment the students are going and coming inside that particular classroom, it resuspends the dust. So we need to really understand and diagnose what could be the possible sources, what could be the possible pollutants in a certain building type. After selecting the pollutants of concern, we really need to review the IAQ guideline values. Now, we are working, it's been quite a while that Professor Khare's team has been working for India having its own set of guidelines. So if we have those guidelines, we can compare those levels with those guidelines and then devise the plan for the IAQ management and maintenance program. So the basic idea is we are not able to calculate the cost in terms of revenue and productivity because of indoor air quality, poor indoor air quality in different microenvironments. The number of days a employee or a student is absent from the school or office also has an impact on the indoor air quality protocol, and the protocol needs to take care of that. Next, please. Now, this protocol also talked about, the monitoring protocol talked about what could be the minimum uh, number of hours that we need to monitor in the different microenvironments that I'm talking about. So for residential, it could be morning and evening, 1 hour each. For the schools, it could be 2 working hours. For offices, it would be again 2 working hours. The idea behind this is that we understand the exposure of the occupants in those microenvironments. hospitals. The healthcare units, morning and evening, 1 hour each, because they have those OPD timings which needs to be catered to. We restaurants would be 2 hours in the evening, and museums will be 2 working hours during the visiting hours. Thank you. Next, please. Besides the monitoring time, it is also important that how much number of samples we need to have for a proper data set that we need to have for indoor air quality. So now this differs from different microenvironments. For residential areas, it would, in a particular location, could be 10%, for offices 5%, 10% of the classroom in any school that we want to monitor, and 15% of the rooms at healthcare centers. So these are important to have the right kind of data that we need to collect using the monitoring protocol. Next, please. These are some of the instruments that we have used. These are not all, but some that we can use or we have been using to monitor PM 2.5, CO2, volatile organic compounds, ozone. Uh, Also, it's important that there is one instrument which is missing here. That's called that's by GRIM. Now, this GRIM instrument has is a very handy instrument. It has PM10, PM 2.5, PM1, and now the recent version has also 0.3 ppm. So it gives us the mass concentration and the number concentration of particulate matter, but it is quite expensive. That is the reason that, but these are the ones which are affordable instruments for research grade indoor air quality monitoring. Next, please. Now, after the monitoring protocol in 2012, we were asked to submit studies, a review of IAQ studies in India on IAQ guidelines across the world for scoping IAQ guidelines in India by MOEFCC in 2018. This is when Society for Indoor Environment, under the leadership of Dr. Prasad Modak and Professor Mukesh Khare, devised this very comprehensive document to understand what is the status of indoor air quality studies in India. Next, please. Now, if you see this research, we found out that rural India, it's mostly the work on IQ research has been done in rural India down south, whereas northern India has worked mostly on the urban aspect of indoor air quality research. Then we also had what are the type of buildings where we have worked. Mostly work has been done in the residential buildings with close follow-up by the commercial buildings. Now, this data is till 2018. So there must have been changes, but this broadly interprets what the report told about. So the commercial buildings, mainly they were monitored were offices, followed by malls and hotels. The public spaces majorly were temples, followed by airport, museums, and metro. Now, why this research is important is because in 2022 April, we got the NGT ordered or requested CPCB that we need to have more work done on guidelines for public spaces. So this document holds relevance in that regards. Next, please. The priority pollutants that we could find out by this review were PM10, 2.5, PM1, closely followed by carbon monoxide and volatile organic compounds, along with SO2 and NO2. Majorly, the parameters that were of importance that we could find in terms of thermal comfort were relative humidity, temperature, and CO2 was very less monitored. So now this has been a major change. As you would see when we go to the airports, now you can actually see the CO2 being monitored in real time at the airports. So this has been a major change. What we need to work on is more amount of cohort studies in India. Most of the studies that I have quoted till now, they are individual studies, they are doctoral studies, or they are researches done by the master students. But what we are lacking majorly is the studies, bigger, larger studies in different cities of or states of India, and mostly having an impact on the health exposure. That is what we look forward to. Next, please. This has been the trend of IQ research in India, with majorly work in urban India, indoor air quality studies done by Professor Khari's group, and down south by Dr. Kalpana in the rural indoor air quality research aspect. Next, please. These were some of the recommendations which were given in the report to MOEFCC. Basic, the crux of it would be that the IAQ needs to be part of the regulatory framework. It has to, it has to be complied with. To start with, this document promulgated that we should follow the way the Hong Kong Environmental Protection Department started its guidelines. So we are not looking at standards as of now. Let's start with the guidelines. And that is what the NCAP also talks about in terms of India having its own guidelines on indoor air quality. Also, in the green buildings, we need to give more weightage to indoor air quality. As of now, a Griha and LEED or IGPC LEED, they give very, very small weightage to indoor air quality. That needs to change. We need to have good amount of prevention and awareness, because most of the time, the people, the stakeholders like architects and HVAC manufacturers, builders, they are not aware about what building materials they are using, and which could actually, in the long run, have an impact on the indoor air quality in that particular area. Next, please. Now, this is the most recent document that has come up after the NGT had requested CPCB, and this is the document that was submitted by Society for Indoor Environment on formulation of interim guidelines for indoor air quality to CPCB. Next, please. This document reviewed all the guidelines, standards across the globe in different countries, Australia, China, Canada. South Korea was the only one which had guidelines and standards as well, whereas the rest of the countries which are shown here, they were following certain guidelines. The OSHA guidelines were also referred to. The idea was to come up to the closest where we can have certain interim guidelines to follow for India. Next, please. This was the roadmap for indoor air quality assessment and management in India, where we really need to club. India is a country which is very diverse in its topography and geography. We need to have three sets of buildings. We need to divide the buildings as mechanically ventilated building, naturally ventilated building, and a mix kind of buildings. The monitoring of indoor air quality circulation along with the ventilation parameters needs to be done for that particular building, whether it is any of the three. We need to identify what could be the potential sources and prioritize them on scale. Now, this prioritization will also be supplemented by the source-wise activity data. Like, I like to mention one incident from my PhD thesis here. I was monitoring in a one bedroom set in a lower income group household. They had one window in that, but what they were doing is they had put their air cooler in that window, closing any kind of ventilation in that particular room. So had we not supplemented the monitoring data with this activity data, it would have been difficult for us to understand the levels of pollutants in that particular microenvironment. We also need to supplement this monitoring data along with the occupants' health complaints with a questionnaire study, which can help us to understand whether the problem is source related, or is it related to the activity which is happening in that particular microenvironment. Like if there were some people who were keeping angithi for keeping the room cool in their room hot in their cold environment in the winter's time. So without realizing the levels that they were also inhaling good amount of carbon monoxide and other gaseous pollutants inside. So this will be a comprehensive assessment, indoor air quality assessment that we are looking at. The data will be qualitative and quantitative in nature. We need to have a pollutant emission load estimation and prediction of indoor air quality before we go down to identifying the what could be the control measures and efficacy evaluation. These all set of data will give us the standards or the guidelines first for the ventilation and contaminant parameters for all the building types that we are talking about. Next, please. Now, these were the proposed interim guidelines of the document that I'm talking about, where we said for the 8-hour average carbon dioxide, the levels could range from 900 to 1100 ppm. PM10, it could be 5. We had given a range, not a number. For a 24-hour average time, PM10 could be 50 to 100 microgram per meter cube, PM2.5, 25 to 50 microgram meter cube. Ozone for a 8-hour average, 75 to 100 microgram per meter cube. Carbon monoxide to be 9 to 10 ppm for a 8-hour average. TVOCs, 400 to 600 microgram per meter cube. Formaldehydes as 80 to 100 microgram per meter cube. NO2 as 40 to 80 microgram per meter cube. Now, this is a good cumulation of all the guidelines that we had studied during the time and come up with this range. So I think if we can follow this range here on, I think that would give us an idea what to compare our data with. So that's over from my end. Thank you. Thank you, everyone, for your kind patience. Thanks.
Thank you, Dr. Priyanka. Now it's over, Mr. Member Secretary and Dr. Saha. So any questions or anything we can take?
करे साहब माइक ऑन कर लीजिएगा प्लीज, बहुत दिन बाद आपसे मुलाकात हो रहा है. प्रियंका ऑल्सो प्लीज.
Yes, sir.
प्लीज. कन्हैया साहब भी आए हैं क्या?
जी sir, he was there. He was there.
राकेश जी स्क्रीन नहीं आ रहा.
He is also there, sir. Rakesh sir is also.
हमारे मेंबर सेक्रेटरी साहब से मुलाकात तो करा दें. कन्हैया साहब इस वाइस चांसलर.
Sir is also there.
जी नमस्कार. I'm there. I was there throughout.
सर आपको देखना चाहिए. आप सर माइक ऑन कर दीजिए प्लीज. स्लाइड्स को ऑफ करके माइक ऑन कर दीजिए प्लीज.
Can you see me now?
Yes, I can see.
Yeah.
Let me introduce our member secretary, Dr. Neeraj.
नमस्कार.
Namaskar.
He was a director Niri.
जी.
Namaskar.
नमस्ते. I think आज का दोनों जो lecture था, it was both of them as usual they were extraordinary. And I'm so glad that Bihar State Pollution Control Board has been organizing this for a long time, and it has had a huge impact. I tell you, no pollution control board is doing this. So congratulations to the whole team there. That's wonderful.
Taneja sir. Taneja sir, namaskar. She is the vice chancellor of Ambedkar University. Taneja sir, namaskar.
Can you hear me?
Yes.
Can you hear me?
Yes, your bold voice is audible to us.
Yeah, actually I am traveling. So actually I am in the train, so kindly excuse me for but I have listened to the presentations. It's wonderful effort, and I think we should continue and get the standards as soon as possible for the country.
Thank you. Question answer is important. Let's know each other. That is important so that we can draw our own vision to some projects. Or that is the main purpose. Just sharing of knowledge is more important for us. Any questions from the audience, please?
Yeah, I have a comment rather than a question. A.B. Gupta here.
Namaskar, sir. Namaskar.
Namaskar. I would like to just make a small comment. The lectures both were amazing, absolutely highly educative, and we look forward to many further studies in future. I'm just sharing one small experience. Almost 20 years back, we were monitoring rural indoors with the lady cook in a sitting posture, making all the meals close to the chula. So we assessed the thermal profiles, and it was interesting to note that during a cooking cycle, the temperatures range from 37 degrees to 57 degrees Celsius. Whereas it's a government rule that if it is exceeding 50, offices, industries have to close down, and that poor lady is facing it every day, twice a day rather, during the preparation of 2 meals. So we assessed a lot of lung function parameters, and we brought out the concept of temperature as a modifier for lungs health. So I believe in your protocols, which were very nicely picked up, the detailing for monitoring is excellent, but I believe it should simultaneously have at least some lung parameters that indicate acute effect. If not others, maybe FEV1 or maybe PEFR, because acute effects are very, very common due to the exposure to indoor air. And second comment that I would like to make is in that Indo-French conference at Nantes, I think it was 2007 or which year, I indicated that if you're using GRIM without humidity correction unit, it gives you absolutely useless values. And then I suggested to the GRIM that they should integrate the two units together, and they have done that. But I believe these even continuous air quality monitors, which have been put in thousands of numbers in India for ambient, they also are fraught with the similar interference. And indoor air is one which always would have a very high humidity level. So something has to be done through modeling the correction for humidity if we are not able to access monitoring equipment to avoid this correction. It will be too much a correction. Maybe the standard deviations would be plus minus 100%, maybe. And I have my primary data to that effect. So first, thanks a lot for this wonderful lecture, and I hope we share more such information in the future as well. Thank you.
Sir, the one thing I would just like to point out, the number of stations or 1,000 number of stations being installed and operating by Central Pollution Control Board in coordination with the State Pollution Control Board. There is a protocol in monitoring and measurement, and there is a preconditioning is the requirement. So preconditioning of the pre and post sampling is the mandatory requirement. If we don't do so, it will not fit the purpose of our monitoring. It is already there. And also for the CAQMS, that is a US EPA approved, the temperature is maintained continuously and constantly. So there is no scope of error in those data. Of course, the quality control is a part and parcel of any program. And if that is done, I hope the error should be less. Our Rakesh is also, I hope also he will agree with me. So that is the thing just I wanted to tell.
But again, my indoor air experience is pretty old. When we were having a GRIM without moisture correction unit, we do have one now. But recent days, if you look at the AQI in places like Churu, Falodi, these are some of the places where heavy fog has been seen. Though pollutant levels are very low, still the AQIs are crossing 200 on a constant basis. Till the point there is enough fog, the PM 2.5 is seen to be highly exaggerated, which is not really indicating the pollution levels, but rather indicating the presence of moisture. That is my contention.
Yes, sir, you are very much correct. But for that purpose, the correction factor is also there. Another advantage of the instrument you have mentioned about it is it counts. It has a counter also. One can count the number of particles also. This is the advantage is there. So that's a very green is a very good instrument for the indoor air quality monitoring also. There is no doubt about it, sir.
Okay, thanks.
So I just wanted to highlight one more point, excellent point from Professor Gupta as well. If you have time, I thought I should highlight this here. One of the concern that we have seen in the literature and also the modeling which has been done in our country, most of the health outcomes. Can you all hear me?
Yes, please.
Okay.
Yes, go ahead.
So most of the health outcomes and diseases are being correlated with outdoor air levels. You see, most of the literature, it talks about outdoor air and then correlation with health outcomes in terms of bronchitis, lung diseases, and things like that. Not realizing that when the person is spending about 90-95% of the time, as Professor Khare and Priyanka also talked about, how come without taking that microenvironment, you are able to correlate that? I think there is a need to go deeper into this aspect so that we are able to create some case studies that based on the microenvironment which currently we have and the real hospital admission which happens, then we work out our backward data collection, that how much of that is coming due to outdoor and how much is because of indoor. So currently the correlation studies, most of them are good studies. I don't want to say anything on that, but I think the whole pizza slice of indoor is missing, and that's what pollution control board can think of initiating some small studies to uncover this whole mystery that we are talking about. So I'll stop here. Thank you.
Just also one of my points that in Eastern India, we have not done any study on indoor air qualities, nowhere. It is all, most of the studies are related to Delhi, whether it is an indoor, outdoor, the chemical properties, the chemical characteristic, the developed condition, but in the rural areas, all these things are missing. We can think in this direction in future, we should think. That is a good point. So, move forward.
I have one point here, Dr. Saha.
Yes, sir.
Because member secretary is sitting here, I would rather suggest that can we start one of the studies in Patna, because Patna is a growing city and is a smart city as well. And there are a lot of high-rise buildings have come up in Patna. So, we can take as one of the pilot studies over there, so that we can compare at least what is the Patna conditions and what are the Delhi conditions. Where Patna traffic is as bad as the Delhi traffic, as an outside source. So that would be really quite great if a state pollution control board can think of, doing such type of projects in Patna urban buildings.
It was a great interaction, and it has enlightened me a lot. And I hope that all the members sitting here could have added to their knowledge. And it was very good to note that we have a clear technology. We can measure the indoor air quality as it has been carried in the case of IGI airport, metro stations, healthcare centers, and one-room apartments also. So, sir, it's a very welcome suggestion to carry such studies in Patna. I was thinking to start in this line from this building only. We can have first analysis of our building, what is our indoor air quality. Because when we visit to foreign countries, they have sensors there in any meeting hall. And when the sensors, when any parameters go out of control, there is an alarm. And all of us vacate the hall, or the ventilation measures is taken to bring the pollutants outside and bring the air quality within the ambit. So it's a very welcome suggestion, sir, and we will be working on it soon. I take this opportunity to thank you, sir, and thank all the participants for interacting with us and putting insight in the very relevant matter of today's world. Sir, I take this opportunity to thank you on behalf of Chairman, sir, because he was about to attend this program, but due to certain medical emergency in his family, he was not able to come. So, sir, thank you once again. Thank you all.
Thank you, sir. Thank you so much.
Can we request for a group photograph if all the cameras are on, please? Screenshot, please, someone. Screenshot. Screenshot लो
Windows plus print screen.
स्क्रीनशॉट दीजिए. Thank you so much, sir. खड़े साहब बहुत दिन बाद मिले हैं, बहुत ही अच्छा लगा सर.
Print screen.
Yeah.
सूर्यांका तो
दिल्ली आइए सर.
Thank you.
हो गया ना?
प्रियंका के साथ भी काम किया मैंने, खड़े साहब के साथ भी काम किया. कन्हैया साहब बहुत अच्छा काम किया. Thank you so much, sir. बहुत अच्छा लगा देख के आप लोगों को. Thank you on behalf of the Bihar State Pollution Control Board. Thank you. Good day, sir.
Thank you, sir. Thank you, everyone.
Getting out. ठीक है. काम